For years, women have been told to take the lowest possible dose of hormone replacement therapy, or HRT, for the shortest amount of time. But what if this advice is actually holding you back from true menopause relief? What if it's contributing to persistent symptoms, leaving you feeling unheard and unwell? And what about that nagging feeling that progesterone just doesn't agree with you? Welcome back to Menopause Wellness Journey. I am Ella Sage, and today we're blowing the lid off some major HRT myths and tackling the complex topic of progesterone intolerance. Get ready to challenge what you thought you knew about menopause management. The lowest dose for the shortest time mantra stems from early interpretations of the Women's Health Initiative (WHI) study. While the WHI provided crucial data, its findings were often oversimplified and misapplied, leading to widespread fear and undertreatment of menopausal symptoms. Many doctors still operating under this outdated paradigm are inadvertently leaving women suffering. The truth is, optimal HRT dosage is highly individualized, and what's lowest for one woman might be completely ineffective for another. Your body, your symptoms, your needs, they all matter. Modern evidence-based menopause care emphasizes personalized medicine. This means your HRT dosage should be tailored to your specific symptoms, your health history, and your individual response to treatment. There's no magic number that works for everyone. Some women thrive on lower doses, while others require higher doses to effectively manage hot flashes, night sweats, mood swings, and other debilitating symptoms. The goal isn't just to prescribe hormones, but to optimize your hormonal balance so you can live your best life. This often involves a process of titration, starting low and gradually increasing the dose until symptoms are adequately controlled, always under medical supervision. Now let's talk about progesterone. For many women on HRT, progesterone is a crucial component, especially if you have a uterus, to protect the uterine lining. However, a significant number of women report feeling worse on progesterone, experiencing symptoms like anxiety, irritability, depression, fatigue, or even fluid retention. This is often dismissed as anecdotal, but progesterone intolerance is a very real phenomenon for some individuals. It's not in your head. It's often related to how your body metabolizes progesterone, particularly the type and route of administration. Oral micronized progesterone, while often the standard, is metabolized differently than transdermal, topical, or vaginal progesterone. When taken orally, a significant portion is converted into neuroactive metabolites like allopregnanolone, which can have calming effects for some, but for others can lead to sedative, depressive, or even paradoxical anxiety-inducing effects. If you suspect progesterone intolerance, discuss with your doctor. 1. Changing the route of administration. Switching from oral to transdermal cream or vaginal progesterone can bypass the liver's first-pass metabolism, potentially reducing unwanted side effects. 2. Adjusting the dose. Sometimes a slightly lower or higher dose, or even a different frequency, can make a difference. 3. Exploring different progestins. In some cases, a synthetic progestin might be better tolerated, though this is less common for intolerance to natural progesterone. 4. Timing of dose. Taking progesterone at night can help mitigate some side effects. The most important takeaway? You are your own best advocate. If your symptoms persist, or if you feel dismissed, seek a second opinion. Look for a healthcare provider who specializes in menopause, who is up to date on the latest evidence-based guidelines, and who practices personalized medicine. Organizations like the North American Menopause Society, EMS, or the British Menopause Society, BMS, can help you find qualified practitioners. Don't settle for feeling unwell. Your quality of life matters. One of the biggest fears women still have is long-term HRT even safe? Decades ago, the Women's Health Initiative raised alarms about breast cancer and heart disease. But here's the part often overlooked. More recent studies from 2017 to 2022, including large-scale meta-analyses published in The Lancet and Climacteric, show that when prescribed appropriately and individualized, HRT can actually reduce risks of osteoporosis, cardiovascular disease, and even cognitive decline. The breast cancer risk, while real in certain populations, is far more nuanced than the headlines suggested. In fact, many experts now believe that the fear of HRT may have done more harm than HRT itself by leaving millions of women untreated. To put it lightly, sometimes the scarier monster is the myth, not the medicine. And here's where it gets really exciting. The future of menopause care is evolving rapidly. Beyond traditional estrogen and progesterone, researchers are studying tissue-selective estrogen complexes, TSX, which combine estrogen with other agents to provide symptom relief without stimulating breast or uterine tissue. Other promising therapies include neurosteroid analogs that target mood and brain fog, and even plant-derived compounds like saffron extract that have shown antidepressant effects in randomized trials. In other words, the toolbox is getting bigger and more precise. Think of it as moving from a flip phone to the latest smartphone. Same purpose, but a lot more tailored features. And no, unfortunately, there's still no Siri for hot flashes yet. Finally, understanding HRT dosage and progesterone intolerance is key to unlocking true menopause relief. By advocating for personalized care and exploring all your options, you can navigate this transition with confidence and vitality. Don't let outdated myths or misunderstood symptoms hold you back. Reclaim your health, reclaim your life. If this video resonated with you, please give it a like, subscribe to our channel for more science-backed menopause insights, and share it with a woman who needs to hear this message. What has been your experience with HRT or progesterone? Share your thoughts in the comments below. Thank you for watching, and remember, you deserve to thrive, not just survive.